Hi, you are watching COVID updates on Voice of Canada, and this is Sana Haroon. Alberta's Chief Medical Officer of Health, Dr. Dina Hinshaw, is asking residents to be safe this Halloween as the province continues to deal with the fourth wave of COVID-19.
Welcome to today's update on COVID-19 in Alberta. With us today is Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide brief remarks and then we'll open the floor to questions. I will now turn it over to Dr. Hinshaw.
Thank you, Lisa, and good afternoon, everyone. Over the last 24 hours, we identified 770 new cases of COVID-19 and completed about 11,800 tests. Our positivity rate was about 6.5%. There are currently active alerts or outbreaks in 288 schools. Of these, 4 schools had 10 or more COVID cases who attended in the last 14 days while infectious. There are currently 912 people being treated for COVID-19 in hospital, including 201 in the ICU. We continue to see these numbers declining, but it's important to remember that this takes time, and this trend could reverse quickly if we are not careful. Sadly, over the last 24 hours, 8 new deaths were reported to Alberta Health. I want to send my condolences to everyone grieving the loss of these Albertans and to anyone who's grieving loved ones lost to any cause. I know their passing leaves a hole in their families and their communities. We continue to see that the majority of Albertans ending up in hospital, requiring care in the ICU, or dying from COVID-19 are unvaccinated. That is why we continue to urge every eligible person in the province, anyone 12 years of age or older, to get fully vaccinated as soon as possible. This is especially important for those individuals who face a higher risk of serious outcomes and those who have health conditions that produce a weaker immune response to the vaccine. It's been wonderful to see a strong uptake from those Albertans eligible for third doses over the last few weeks. So far, more than 231,000 booster doses have been administered to those with severely immune-compromising conditions, to First Nations, Métis and Inuit individuals aged 65 and older, and to seniors aged 75 and older. If you are in these groups, please remember that an important time period needs to pass between getting your second dose and when you can get your booster. For those with one of the eligible immune-compromising conditions, the booster can be administered 8 weeks after your second dose. This is because for these people, the third dose is considered a part of the primary series. For everyone else who is eligible, the third dose is a booster to strengthen and prolong the protection from the primary series of 2 doses. Waiting until 6 months have passed since your second dose is important in order to maximize how long the protection will last. Before booking, if you are 75 and older, or First Nation, Métis or Inuit individual 65 and older, please check the date on your immunization record to make sure that you are now eligible and that 6 months or more has passed from your second dose. While we offer boosters to these groups, we also know that there are still people who don't have the protection that the first and second doses of the vaccines offer. There continues to be a lot of misinformation about vaccines on social media that we are working hard to address. In particular, we have heard questions about whether the vaccines impact fertility or are safe for pregnant women. As I've said before, there is no evidence suggesting that these vaccines impact fertility in any way. Studies done on both male and female fertility outcomes after vaccine have shown no negative consequences. Vaccines are also recommended for anyone who is pregnant or nursing, as the risk of severe outcomes of COVID infection in pregnant women has increased with variants of concern. Vaccine safety is a critical issue in pregnancy, and data from thousands of pregnant women who have received vaccine has not shown any increased risk in pregnancy. However, I know that Albertans still have questions about this. So to help answer these questions, I will be hosting a telephone town hall next week, joined by other physicians to answer questions about vaccines, fertility, and maternal health. This town hall will be open to anyone who is interested in this topic. I'll be tweeting out a registration link and sharing it online as soon as possible. It's free for anyone who wants to call in and ask a question about this issue. I'd like to end today by talking about Halloween, which is little more than a week away. I know that many Albertans eagerly anticipate this day, as my children and I also do. The fun of finding the right costume and going out trick-or-treating is part of the joy of childhood, and we can keep this joy while at the same time protecting our communities. I'm asking Albertans as clearly and strongly as possible to please be wise and safe while celebrating this year. We have posted tips and advice online to keep our Halloween fun on the safe side. I'd encourage everyone who is planning activities to review this information. There are a few key pointers that I'd like to flag right now. First, and this is most important, if you are sick with even mild symptoms, please stay home and don't hand out candy. Second, this is not the year for large Halloween parties. If you're planning a Halloween gathering, try to have it outdoors and make sure that the limit of no more than 20 people is observed, with 2 meters of distancing between members of different households. For indoor Halloween gatherings, the current public health restrictions strictly limit social gatherings in private residences to no more than 10 people from 2 households for those who are fully immunized. For eligible adults who are not fully immunized, indoor private social gatherings are not permitted. If you're going trick-or-treating, be sure to wear a non-medical mask and go only with your own household members. Sanitize your hands often, especially before eating treats, and keep your distance from others. If you're handing out treats, you should also wear a mask and try to limit contact with others. This could mean using tongs to hand out prepackaged treats or setting them out on a blanket or tray for contactless pickup. If you are setting out treats, avoid using a bowl, but please keep those treats spaced apart. Last year, we saw many generous Albertans get innovative when finding ways to safely deliver candy, and I heard from many Albertans who enjoyed the day. We can have fun with it again this year, with creative ways to celebrate the occasion. While our numbers have been falling over the last few weeks, with rising vaccination rates combined with our public health measures to reduce transmission, we still have a long way to go. Last Halloween, we had about 5,600 active cases. Right now, we have almost double that amount. Last Halloween, there were 141 COVID patients in hospital. Right now, there are over 900. This Halloween, we can still have fun, but please do it in a safe way. Thank you, and I'm happy to take questions.
We'll now take questions from the phone. Please limit yourself to one question, one follow-up. Operator, please put through today's first caller.
Thank you, Bill Kaufman, Post Media.
Yes, Dr. Hinshaw, as you know, we've just recently surpassed the 3,000 mark for COVID-19 deaths in the province, and I know that there are a number of doctors here who have said that we needn't have had this many deaths. That particularly in the fourth wave since last summer, a lot of these were entirely preventable. What would you say to that?
I would say that every life lost to COVID is a hole in the fabric of our communities, and that the fourth wave has brought with it a tragic death toll, and that many of those individuals were individuals, in fact, most of those individuals were individuals who were completely unvaccinated, There's a small proportion of those who did have 2 doses, who had a breakthrough infection that led to the most severe outcome of death. And of course, that's exactly why we put public health measures in place to limit the spread, to bring down the numbers, and we are strongly encouraging all Albertans to be fully immunized. So are the deaths preventable? Yes, the majority are preventable. And again, the number one thing that all of us can do to prevent death is to be fully immunized. And so again, would encourage Albertans who are not yet protected by vaccine to make the choice to protect themselves and those around them, because there are some individuals whose immune systems are compromised from medical conditions or for other reasons who don't respond fully to a full course of vaccine. And so again, we all need to step up and be a part of the protection around those individuals.
Bill, did you have a follow-up?
Yes, I know that the Prime Minister today was talking about vaccine for those aged 5 to 11, but there's no deadline in Canada for when that vaccine or vaccines would be approved. I mean, how much of a concern is that? How important are these vaccines to Albertans? And I'm kind of wondering how many Albertans would be affected by that. How many children are in that age group here?
I'm afraid I don't know the number of children 5 to 11 in Alberta off the top of my head, but of course that particular age group is one that we have been looking forward to having the opportunity to have vaccine available for. We know that Health Canada received the data from Pfizer around the safety and efficacy of the vaccine for children in that age group just this week. And so it is absolutely critical that they take the time they need to assess that data and follow the steps that they take when assessing new vaccines. We know that this particular formulation is a little different than the one used for adults in terms of having a slightly lower dose. And we want to make sure that we're waiting for that review that Health Canada does before making that vaccine available to children. Of course, it's going to be important to be able to offer that, again, not just for children, particularly those who may have health conditions that may make them slightly higher risk than others, but also because we know that, especially with the Delta variant, that children can transmit more readily to others. So it will be important to have that option. But again, the number one concern at this particular moment in time that I have is to make sure that Health Canada, as of course they are doing, as they always do, takes the time that they need to make sure that the vaccines pass all of the tests that all vaccines pass, so we can confidently offer it to children in Alberta.
Operator, are there any other questions on the line?
There are no further questions today.
Canadian kids will be able to get the first doses of the Pfizer COVID-19 vaccine soon after the shots are approved by Health Canada, says Prime Minister Justin Trudeau.
Prime Minister Justin Trudeau made the announcement outside of a children's hospital in Ottawa early Thursday, adding the National Health Regulator is already reviewing the drug company's submission, which was received this week, but couldn't give an exact date for the approval or the vaccination rollout.
I know that parents are eager to see the vaccines available for 5 to 11-year-olds, but I also know that parents want to know that those vaccines will be safe, which is why Health Canada will be taking the necessary time and rigorous processes to ensure that that is safe before approving it.
Children aged 5 to 11 will get 2 shots of the lower dosage vaccine, 1/3 the amount of adults, 3 weeks apart. The doses will be administered using a smaller syringe. While experts have found young children are at lower risk for severe COVID, Toronto pediatrician Dr. Anna Banerjee says reaching this population could help boost herd immunity.
Having the younger kids vaccinated increases the chances of them going forward and less schools closing down, less outbreaks, less people getting infected.
Canada's Public Health Agency has noted rare incidents of myocarditis, an inflammation of the heart muscle, post-vaccine. something the National Advisory Committee on Immunization, or NACI, will weigh in on once it looks at the benefits and risks of the shot for young kids.
Doctors say strict COVID-19 measures are urgently needed in Saskatchewan, where new modeling paints a dire picture of the crisis unfolding in hospitals.
Joanne Fellner does not have COVID-19, but for the last 3 weeks, the 75-year-old Regina woman has been in intensive care. This week, her family received word she could soon be moving to Ontario.
My dad received a letter, just more of an information letter, saying that all ICU patients are considered for a move. There are no exceptions.
A surge in COVID-19 patients has pushed ICUs far beyond their usual capacity. So far, 6 patients have had to be sent out of province for care. 3 more patient transfers are planned for this weekend.
It's tough on families, and it's quite traumatic both for the teams that are having to put patients through this and also for the families. But unfortunately, there isn't really any other good option.
The province has 136 ICU beds available, but according to modeling released by the Saskatchewan government, without new public health orders, there could be more than 200 ICU patients in the province by the beginning of next year. Only scenarios that included booster shots for those over 60, combined with gathering limits, project ICU numbers being brought under control. The situation so serious, Saskatchewan's chief public health officer was brought to tears.
I have no shame in pleading to the public that, we've gone so far, and, we just have to pull along for the next few weeks and months. And, it is distressing to see what is happening in our ICUs and hospitals. And I'm sorry, it's a very challenging time.
The Canadian Medical Association is calling on the Saskatchewan government to bring in new public health measures now.
We cannot possibly accommodate 200 critically ill patients. That is an impossibility. We will not be able to manage that number of patients without either evacuating them to other provinces or implementing triage.
A cold reality already forcing families to send their loved ones far from home.
The federal government is pulling the plug on several COVID-19 support programs starting Saturday. Deputy Prime Minister and Finance Minister Chrystia Freeland announced Thursday.
We are announcing what we very much hope and believe is the final pivot.
The final pivot. It's the Liberal government's plan to replace expensive, broad-based support programs with more targeted and limited financial help.
We're now in a new phase, one that is very different from the darkest days in our fight.
Most of the support in this new phase will be for travel and tourism businesses, which can continue to get a 75% wage subsidy. But employers in other sectors would have to show at least a 50% drop in revenue just to qualify, and that would only get them a 10% wage subsidy.
The bar is too high and the subsidy too low to make a big difference for many businesses that are hanging on by their fingernails.
Support for individuals will be limited to specific situations. For example, if a local public health authority imposes a temporary lockdown, Canadian workers could be eligible for a $300 a week benefit.
We're putting this insurance policy in place now to ensure that provinces, territories, and municipalities can continue to make the right public health choices.
New Democrats say the Liberal plan is unacceptable.
We know that there are a lot of Canadians who are still depending on these benefits while we're right in the middle of the fourth wave.
While Conservatives have been pressing for weeks to wind down support programs they say are adding to dangerous debt levels.
We do support programs that are going to get us through the pandemic, but we also believe there has to be a plan in place that's going to get a grip on our national finances.
Ontario Premier Doug Ford released the province's plan on how it would begin loosening and eventually lifting remaining public health measures brought in to combat COVID-19.
Well, good afternoon. I said to you last week that our government was in the final stages of developing a plan to safely reopen Ontario. I said this plan would stand the test of time. This plan is designed to bring certainty and predictability to what our response to the pandemic will look like in the coming months. We've worked side by side with the Chief Medical Officer of Health, our medical health professionals, to put in place a plan that will lead us through the winter. and out of this pandemic. Today, we're sharing with all Ontarians what they can expect over the next several months. I'll ask Minister Elliott to speak to the details shortly, but I want to highlight a few key principles that guide this plan. To begin with, we're sticking with what's worked for our province. This is a cautious plan. It slowly lifts public health measures over time, allowing us to monitor any impacts on our hospitals and in our communities. It provides Ontarians and businesses with the certainty they need to make the plans of their own. It will do everything possible to avoid broad lockdowns while enabling a tailored and localized response should we need to act. And it provides a clear end state for when remaining public health measures will be lifted, including when proof of vaccination will no longer be mandatory. While necessary to control the spread of COVID-19, the public health measures in place, including vaccine certificates, these are extraordinary measures. We said we would keep them in place one day long. We would not keep them in place one day longer than necessary. We said we'd remove them as soon as it's safe to do so. My friends, that's what this plan does. With the next step of measures easing on Monday, October 25th, when we lift capacity limits and distancing requirements for restaurants, gyms, and casinos, where proof of vaccination is required. I'd like to take a moment to acknowledge why we're in the position to confidently make these plans. It's because our health indicators show that we're on the right path. We are here because we stayed cautious, we stayed disciplined, and we never underestimated this virus. We look to other countries, other provinces. There can be no question that this was and is the right approach. We always put the health and safety of Ontarians first and focused on delivering one of the most successful vaccine rollouts anywhere in the entire world. And because of that, because of the hard work and the selflessness of Ontarians, we can see the end of this pandemic in sight. But it's not over yet. We can't get too comfortable or let our guard down. But we're going to be able to begin getting back to the lives we want. This shows how far we've come by working together and protecting each other. And there's a really important point I want to highlight. One that should drive home just how well Ontarians have done in battling the virus, and that it is the ICU capacity in our hospitals. We made clear that all the measures that were in place, all the restrictions, they were intended to protect our hospitals, and that our number one priority was to fortify the hospitals and increase our ICU capacity. Today, I can say that we've achieved this. Our ICUs are strong with under 150 cases, as we added thousands of new critical care and hospital beds. That's why we have the capacity necessary to support other provinces who are struggling and need our help. We should all be very proud of how far we've come and know that it's because you all worked together. You supported each other and you rolled up your sleeves to get the vaccines that provides everyone with a maximum amount of protection. Now I'm going to hand it to Minister Elliott to walk us through the details. But I need to say again, she continues to be an absolute all-star as the Minister of Health. She and her team work nonstop around the clock, and I'm very grateful to the Minister. I will now pass it to Minister Elliott. Thank you, and God bless the people of Ontario.
Thank you very much, Premier. Good afternoon, everyone. Since the onset of the COVID-19 pandemic, our government has taken a cautious approach to reopening to protect the health and safety of Ontarians. And as the Premier said, we've made significant progress in our fight against COVID-19 thanks to our gradual approach and the efforts of millions of Ontarians. Through our plan to safely reopen Ontario and manage COVID-19 for the long term, we will replicate our earlier success by slowly and incrementally lifting all remaining public health and workplace safety measures by March 2022. And this approach will continue to be guided, as it always has, by the ongoing assessment of key indicators, such as potential new COVID-19 variants, increase in hospitalization and ICU capacity, and rapid increases in transmission. This cautious and gradual approach will prevent widespread closures, protect our health system capacity, keep our schools open, and support Ontario's economic recovery. As a next step, based on the continued improvements to key public health and healthcare indicators, effective October 25th at 12:01 a.m., Ontario will lift capacity limits in the vast majority of settings where proof of vaccination is required, including in restaurants, bars, gyms, and indoor meeting and event spaces. At the same time, other settings will be permitted to lift capacity limits if they choose to opt in to require proof of vaccination. This includes settings like personal care services, such as barbershops and salons, and the indoor areas of amusement parks, museums, and galleries. However, proof of vaccination will not be required in settings where people receive medical care, food from grocery stores, or basic medical supplies. At no time will people be denied these services based on their vaccination status. We will continue to monitor the effect of these capacity limits being lifted to evaluate the impact to key public health and health system indicators, particularly over the winter holidays and as students return to school. And in the absence of concerning trends in public health and healthcare, we will continue to cautiously and gradually lift other public health measures in November 2021 and January, February, and March 2022. Notably, if the situation is not deteriorating and in the absence of concerning trends, on January 17, 2022, there would begin a gradual lifting of vaccine certification requirements, Chief Medical Officer of Health directives, and capacity limits in settings where proof of vaccination is not required. Other public health and workplace safety measures, including masking, would remain until March 28, 2022, at which time they will be lifted. We know this is encouraging news for Ontarians who have sacrificed so much over the last 20 months. But we need to remain vigilant. Over the last week, more than 4.8 million Ontarians have downloaded their enhanced vaccine certificate with official QR code. There are also 979,000 people using the Verify Ontario app. Thank you to Minister Rashid and your incredible team for helping to develop these tools. So if you haven't already done so, I encourage you to download yours today and take advantage of this easier and more convenient option to show your proof of vaccination. Today is a milestone in our fight against COVID-19. We have a plan to safely manage this virus in the long term and protect the health and well-being of Ontarians while ensuring Ontario remains open and recovering. Thank you all, and now I will pass it over to Dr. Moore.
Thank you, Premier and Minister Elliott. Good afternoon, everyone. Throughout the COVID-19 pandemic, the province has been guided by science and evidence when making decisions on how to keep Ontarians healthy and safe. And Ontario's strong COVID-19 vaccination rates and extensive public health measures have had and continue to have an impact. The trends in public health and healthcare indicators remain stable or improving, and the province is currently trending toward the best case scenario projected by the Ontario COVID-19 Science Advisory Table. Ontario's weekly case rate continues to decrease, and we are reporting one of the lowest weekly case incidence rates in the country, well below the national average. And while we never wish to see anyone admitted to an intensive care unit, the rate of COVID-19 ICU admissions remains stable. The province vaccination rate continues to climb, with 87.7% of eligible Ontarians with one dose of COVID-19 vaccine and 83.6% with 2 doses. I want to take this opportunity to acknowledge Ontarians for their commitment to limiting the spread of COVID-19 by getting vaccinated and following the public health measures. You are protecting yourself, your family, and your community through your actions, and I want to offer my sincere thanks and gratitude to you all. Because of your collective efforts, our schools remain safe, places to learn, and our businesses are safe and open. And because of you, the province is now in a position to implement a plan to continue the safe reopening of Ontario by gradually lifting remaining public health and workplace safety measures over the next several months. While we are optimistic about the future, the province will continue to monitor this situation very closely, and we will respond quickly to protect Ontarians' health, should the need arise. To manage COVID-19 over the long term, local and regional responses will be implemented based on local context and conditions. Public health measures would be applied provincially in exceptional circumstances, such as when the province's healthcare system capacity is at risk of becoming overwhelmed, or if a vaccine-resistant COVID-19 variant is ever identified in the province. And as these measures are gradually lifted, we must stay vigilant, as we do not want to cause any more disruption to people's lives. As we move ahead with reopening our province, Ontarians must remember that we need to continue to follow public health measures, such as washing our hands, wearing a face covering, and physical distancing, and to help ensure a safe reopening for everyone. It's also important that we continue the critical work to vaccinate those who have not yet received their shots. Vaccination saves lives, helps keep people from severe outcomes, including hospitalization and death. Vaccination continues to be the key to getting us out of this pandemic, so I ask that anyone who is not fully vaccinated to please protect yourself, your family, and your community, and get your shot as soon as possible. We want to continue to keep moving forward, never backward, with more closures and lockdowns. Thank you.
We'll take questions at the mic. If the journalists in the room could just form a line behind me. And just a reminder, it's one question, one follow-up.
Hi, Shal Neethong, CTV News. This question is actually for Dr. Moore. As we enter the colder months, Dr. Moore, if cases were to turn around, if things were to become worse, we'd heard Dr. Isaac Bogosh say today that when ICUs start filling up, it's already too late. What is the indicator you're actually going to use if things have to turn around? Is it ICU capacity or is it case count?
ICU capacity is one of the most important markers that we have. It is the finite capacity within the province, although we've done significant work to try to increase that capacity. So we'll be watching those at a regional level especially. We've built increased capacity across the province. We've got a very good system now to respond to local rises in cases. We've got regional programs in place to work with our local medical officers of health, both within a health unit and at a regional level. And then if it begins to spread regionally to higher levels within the province, we also have plans in place. So those are the key metrics, hospital utilization and the intensive care capacity.
My next question is about the opt-in strategy. That'd be for Dr. Moore, perhaps Minister Elliott. Is there a system in place where businesses can actually inform the government that they're opting in, or how does it work?
So opting in will be at a local level, that they have to put signage in place if they're opting in to the immunization certification process. If they want to do it for an event and or for a 24-hour period, that would be signage, public disclosure, and then that would be enforced by the local bylaws or public health agency as needed, and to ensure that they're compliant with the certification process.
Hi there, Richard Southern with City News 680. Premier, when you talk about hopefully lifting the mask mandate by the 28th of March, will that include schools, and are you confident that it'll be safe to do that? Are you confident that students will be able to be vaccinated by then, sir?
Well, March is a little ways off. We'd have to look at the numbers. I'd always consult with the Chief Medical Officer of Health, consult with the frontline education folks and the Minister of Education, and then we'll determine it from there. But I think we'll see what happens.
On another matter, sir, there's a big impasse between your government and the optometrists. A lot of seniors can't get their eye tests done. They don't want to return to the bargaining table until they get what they think they're owed. Your health minister has spoken recently about this, but I'm wondering, sir, will you intervene in this? Will you do anything to get this situation fixed?
Well, first of all, I have all the confidence in the world in the negotiating skills of the Minister of Health, and before I pass it over to the Minister, you know, in government, we've negotiated a lot of deals, and you can't negotiate when someone doesn't come to the table. And, you know, we showed good faith. I think it was $39 million we gave them, but you can't negotiate by yourself. So I encourage them, please come to the table. Let's get a deal done. As Premier, I'm asking you, please come to the table. You know, the only people you're hurting are the people of Ontario. So I want a deal done. I have all the confidence in the world in the Minister of Health, and I know we're going to get a deal done, but we can't do it by ourselves. I'll pass it over to the Minister.
Well, we are certainly very anxious to resume negotiations with the Ontario Association of Optometrists. We have already paid $39 million into their accounts to cover the increases that they would have got based on physician increases from the period when their last agreement ran out in 2011 until today. But there are future increases. We've offered an 8.48% increase going forward, retroactive to April 1st of this year. And we also want to understand the overhead issues that the optometrists are concerned about. But we can't resume mediations with only one party at the table. So we urge the optometrists to come back to the table. We want to speak with them. We want to come to a solution that is going to be satisfactory to them and, of course, satisfactory to the taxpayers of Ontario, because we have a responsibility to be sound financial guardians of taxpayers' money. And so we want to start those discussions. We are continuing to fund those OHIP-funded services for young people and seniors over age 65. We are anxious to continue to do so, and they want optometrists to continue providing those services. So we ask the optometrists, the association, to please come back to the table so we can reach an agreement as quickly as possible. Thank you.
Matthew Bingley from Global News. Just on the vaccine certificates, you begin to roll them back in the dead of winter. Science experts are saying that you should probably wait until spring because that's the highest risk time. So I'm just wondering what the rationale is for rolling it back when everybody's inside and it appears to be higher risk.
Well, the numbers seem stable, and like we said, I want to be cautious, very cautious moving forward. We're one of the most cautious provinces in the whole province. Matter of fact, one of the most cautious in North America. But in saying that, if the numbers are stable, and before I'm going to pass this to Dr. Williams, but if the numbers are stable, this isn't a one-way street, by the way. It's a two-way street. One-way street, we just can't keep going down and down when the numbers are low, and we have approximately 400 and change in cases and ICUs that are 150. We have the capacity. It has to be a two-way street. You know, there has to be benefits to the people across Ontario to see all the hard work that they've done, and they're able to see the difference. But let me reinforce the word cautious. We have always been cautious. I'm going to be super cautious. If we do not see the numbers in a stable place, we just aren't going to do it. It's as simple as that. But I'll pass it to Dr. Moore.
That's an excellent question, and thank you for it, because as we get into the colder months, this virus does want to spread. As the humidity inside goes down, the virus wants to spread. It's a call for more people to be immunized to decrease the overall risk to our population heading into the winter. We don't want to see more people in the intensive care unit. The good date that we've set, which I think is absolutely appropriate, is January 17th to review the data. That will give us an opportunity to review the preceding 2 months of potential activity within Ontario. It'll let us get through the holiday season and analyze if there's been any spread within social settings or in other workplace settings to make an informed decision. So the Premier absolutely is correct. We will be following the data. We'll be analyzing it very closely heading into January 17th to make a decision whether we move forward. And as we've seen through step 3 of the reopening, we took our time. We were cautious, and I think that has saved lives, and we'll do the same again and again to protect the health of Ontarians.
Dr. Moore, if I could just follow up with you. The the March date next year for masking potentially to be lifted, what is it about that date that, from this point that you can confidently say that you can lift masking regulations based on, what we're seeing with the UK right now, what the science table noted with Nordic countries when they withdraw them? What is it about March?
By March, we hope we've maximized our immunization strategy in Ontario, that we have more Ontarians immunized to the point that this virus doesn't have a host in which it can reproduce. We'll have our third dose strategies will be completed. Our immunization strategy for children from 5 to 11 will have been completed, and we'll have a very good point to be able to look at the data to review a safe opening for all of Ontario, and then we will have to learn to live with this virus. But it gives us a significant amount of time to build up the immunization protection of our population, and sadly some will acquire immunity naturally, but our goal is to continue to maximize our immunization strategy during this time. We're not stopping. The last mile strategy is continuing to further protect Ontarians, and then as we go outside, the risk does decrease. We've seen that naturally after every respiratory virus season, including after COVID-19. The risk does decrease, and we do hope as we continue the high immunization rates that we can have a great spring and summer and fall following in 2022.
Harrison Lohman, TVO. Hi. Question for the Premier here. Premier, the federal Liberal Employment Minister, Carla Qualtrough, said yesterday, I believe, that it's likely that people who will lose their jobs for not complying with employer vaccine policies will not be eligible for employment insurance, EI. I'm wondering if you agree with that or what you make of that.
Well, that's up to the federal government, but something, my heart breaks for everyone across the province has seen the challenges, and let's make no mistake about it. Folks, just get vaccinated. That's what it comes down to, and that's what I'm trying to push. I don't want anyone to lose their job. I really don't. It really bothers me. But in saying that, the priority is to make sure that they get vaccinated. The reason we're able to move forward is because people went out and got vaccinated, and hopefully another week or close to it, we'll hit our 90% target on the first doses, and shortly thereafter the second doses. But folks, just get vaccinated.
Mr. Premier, the next election is scheduled for June 2nd, 2022.
Yes.
You've denied claims in the past that you'd call an early election before that date, and I'm wondering today if you will commit that the next Ontario election will in fact take place on June 2nd, 2022.
I will commit. The next election is June 2nd.
Thank you.
Thank you.
Hi, Premier. Adrian Gober with City News.
Hi, Adrian.
You just mentioned, how important it is to continue to encourage people to get vaccinated. Yep. Though you've just given those who are not vaccinated a finish line, an end date, as to when they'll be able to start to go back into restaurants and not have to show their proof of vaccination. Do you think that's counterproductive considering the measures and the steps that you're trying to take?
I don't think so, because we still have a couple months left, and we're seeing vaccinations every single day, even first doses. What I really like is the first thing when they send it to me every single day, I look at the first doses, and we still see 6,000, 7,000 first doses coming on board. So people are coming on board, and I'm just hoping that if we continue over the next couple of months, well, we will be over 90% by then. Just keep getting vaccinated. That's what, but we can't forever, to the end of time, just ignore the people that aren't vaccinated. They're part of Ontario. Again, I'll be up here preaching every single day to get vaccinated, but there has to be a time that everyone eventually comes together, and our vaccination rate is high enough, and our ICUs are in good shape. So that's going to be the determining factor.
On the anti-vax front, I've spent the last couple of days following independent MPP, Mr. Hillier, who has been posting photos of individuals on his social media who've recently passed and claiming that they died due to the COVID-19 vaccine. Multiple families of these deceased individuals have spoken out, saying that's untrue, that's my loved one. They say they're being further traumatized. They're wondering what kind of recourse they might have. Do you believe that an elected official can continue to perpetuate misinformation, share misinformation, and hurt Ontarians? And what can be done, if anything?
I think it's appalling an elected official would do that, put someone who's passed away for another reason and post it and say it's because they had vaccinations. It's disgusting, in my opinion. That's the reason Randy Hillier is not part of our party. That's the reason Randy Hillier will not win the next election if he decides to run. And ironically, Randy Hillier's riding is the highest vaccinated riding anywhere in Ontario. So they don't believe in him either. I think this guy, I always said before, the cheese slipped off the cracker with this guy. He's gone rogue. The guy's lost his mind, in my opinion. And I ignore him. I think it's ridiculous. I wouldn't even give him the time of day if I were the media. That's what he loves.
Hi, Premier Jeff Gray, Globe and Mail.
Hi,
How
Jeff.
are you?
Good. How are you?
I wanted to ask you about the restaurant business.
Sure.
I hadn't heard the sort of level of anger from business lobbyists over that time after the rules were loosened for the hockey rinks and so on in years. Are you contemplating any moves to repair that relationship? This is small business. These should be natural constituents for you and your party.
Yeah, so when it goes to the OHL, the small little urban hockey teams, or the NHL, I always consulted with their chief medical officer of health. And being in a large arena with the airflow a lot better, I was told we had consensus, we moved on it. Now, it's only been about a week or 2 weeks, that now we're opening up the restaurants. I have supported the restaurants. My heart bleeds for these small business owners. We support them to a tune of $4 billion, and I'll always support them. But this is why we need people vaccinated. We need to get it moving forward, and I'll always be there to support them. And I apologize for, if it's been 2 weeks and we didn't line them up side by side. But again, I always consult with the chief medical officer. He gave us the green light, and maybe, I won't even ask him to come up. That's what happened. He said move forward, we move forward, and now we're going to move forward with the restaurants.
This will be the last question.
Well, and I think that's what the restaurants are saying. I mean, I think you're right. It was a symbolic thing that they have hurt for so long through this whole thing, unlike maybe any other business. Yeah. And now with patio season ending, a lot of them are hanging on by their fingernails, they tell me. One thing they've asked for years is for the province of Ontario to cut the cost that they pay through the LCBO system for their liquor. They pay way more than any other jurisdiction. Is that something that's on the table, that's on your radar, that you might offer them as a way to get this business back in
So we're looking at that, and I just want to remind you, we're only government that allowed them to do this. So we're going to keep that moving forward. We're going to come up with any idea we possibly can to support these restaurants. I'm a big believer in small businesses and entrepreneurs, and we're looking at that. But I just want to remind you, there's a support that we gave them, plus their opportunity to sell a bottle of wine or a bottle of liquor. I think it's really helped them. So that's what I believe we're going to be doing, is continue to support them and allow them to sell their alcohol. But before I finish, I just want to say that next week is Respiratory Therapy Week, and these are some of the absolute heroes on the front lines of our pandemic response, and I want to recognize them for everything they've done. So a huge thank you to our world-class, and I say world-class respiratory therapists for everything they've done for us. We're very, very grateful. Folks, I thank you. We're moving in the right direction, not because of me, not because of our government, because each and every one of you. I'm very, very grateful. So thanks, everyone, and have a very safe weekend. All the best.
Thanks, everyone.
UK Prime Minister Boris Johnson spoke Friday about the ongoing need for people to get their COVID-19 vaccination, but barked at the idea of another potential COVID-19 related lockdown.
Full lockdown this winter with stay-at-home advice, shops closing, is that out of the question?
I've got to tell you at the moment that we see absolutely nothing to indicate that's on the cards. I think that people should be coming forward with the same spirit of determination to get their boosters, as we saw earlier on this year. It's a very good thing to do. It gets you a huge amount of protection, and we always expected that we would see numbers rise right about now. That is happening, and you've also got to take into account the waning effectiveness of the first 2 jabs. So get your boosters now. We also want young people, we want kids at school to be getting their jabs with complete confidence, and there'll be booking systems opening from tomorrow in addition to the vaccination program in schools. So our autumn and winter plan always predicted that cases would rise around about now, and we're certainly seeing that in the numbers. We're seeing high levels of infection, but they're not outside the parameters of what was predicted or what we thought we'd see in the autumn and winter plan. But it's very important that people do follow the guidance on general behaviour, on being cautious, on wearing masks in confined places where you're meeting people you don't normally meet. Wear a mask, wash hands.
Ontario has announced plans to lift all COVID-19 public health restrictions by the end of March 2022. It's only been 2 weeks since arenas, theatres and cinemas opened up.
Andrei Yakovenko is eager to be fully open after more than a year of COVID restrictions and lost revenue.
It's been a challenge. We're probably still missing well over 50% of our client base.
At midnight on October 25th, Ontario businesses requiring proof of vaccination will again be allowed to operate at full capacity, with the goal of removing all precautionary measures, masking, vaccine passports, social distancing, by the end of March.
By March, we hope we've maximized our immunization strategy in Ontario, that we have more Ontarians immunized to the point that this virus doesn't have a host in which it can reproduce.
This includes first and second doses for kids from 5 to 11 and booster shots for at least some. But there is concern the province may be jumping the gun. It's only been 2 weeks since arenas, cinemas, concert venues, and theaters opened back up to full capacity, and health experts say this plateau may not be permanent.
We need to wait still a few days until we start to understand how this last step of the reopening process actually impacts us.
Patience that could help Ontario avoid the same mistakes as other provinces, where critical care units are still struggling with the consequences of reopening too soon. Or take Finland and Denmark, 2 northern countries facing climbing cases after lifting most public measures.
If we do not see the numbers in a stable place, we just aren't going to do it. It's as simple as that.
Small businesses say another lockdown could be crushing.
I think it might be too late for some, but those that are able to make a go of it, this will really help.
Terrified during the early days of the first COVID-19 lockdowns, 65 years old Kathleen Zane took a leave of absence from her call center job.
Terrified during the early days of the first COVID lockdown, 65-year-old Kathleen Zane took a leave of absence from her call center job. She says she was unable to get a loan from her bank, which charges less than 8% annual interest.
Nerve-wracking. I was just scared to death.
But she already had a high-interest loan of $1,500 with Easy Financial, which she increased to nearly $5,000, still at an annual interest rate of 30%.
It was such a relief off my mind, because I was like, what the hell am I going to do?
This summer, she says she was shocked to see how much interest she was being charged.
I thought, oh my God, I've been ripped off. That's how I feel now. Now I feel like, you stole my damn money. How dare you?
In an email to Global News, GoEasy, the parent company of Easy Financial, said it provides a copy of the full loan agreement to every customer immediately after signing and walks the customer through key elements of the loan, including interest rate and total cost of borrowing. Its customers are hardworking, everyday Canadians that have typically been turned down by banks and traditional lenders. After interviewing people with similar types of installment loans from Money Mart, Global reached out to the company for comment but did not receive a response.
We found that a lot of the payday lenders and the installment loan companies are taking advantage of the situation because they know people are desperate for money.
Anti-poverty group Acorn says it's seen a surge in uptake of installment loans during COVID. In 2020, they were 300 times more popular than in 2016. Although payday loans charge a lot more interest, installment loans, which are also offered by many payday lenders, are typically much larger sums of money, tens of thousands of dollars as opposed to hundreds. Acorn wants to see the criminal rate of interest come down to 30% to target installment loans. That's still more than the 20% most credit cards charge. Canada's largest insolvency firm says many high-interest loans aren't well understood by consumers.
If you don't budget properly and use it as a proper tool, that's when it can get scary.
Patricia Edwards turned to Money Mart for high-interest loans to help with cash flow. The interest makes it hard to get ahead.
It's an endless cycle. It's like being in a tornado and you're just whirling around month after month.
Although Canada is not out of the pandemic yet, parts of British Columbia and Ontario are lifting their COVID-19 capacity limits as of midnight Monday.
In Saskatoon Saturday, thousands attended the concert of country music star Eric Church. And though everyone had to show proof of vaccination in the midst of a punishing fourth wave, the crowded venue images provoked concern.
I wouldn't be surprised if there is multiple outbreaks, happening that is associated with that concert last night.
Saskatchewan has had no gathering or capacity limits in place since the summer, something many in the medical community have been pushing to change as the province now sends critically ill patients to Ontario. It's a stark contrast to the situation elsewhere in Ontario and BC, where many public health measures have remained in place well into fall. This week, venues in Metro Vancouver and on Vancouver Island will finally return to full capacity.
In terms of the larger venues, we were the holdouts with respect to the rest of Canada, so it would have required a very significant and convincing explanation to not do it. So in that context, I think it is the right step at this time.
Ontario is also lifting business capacity restrictions this week.
That's not unreasonable, with a huge caveat that if we start to see things headed in the wrong direction, you've got to scale things back a little bit.
Ontario is now looking towards the end of all restrictions, easing vaccine passport requirements beginning in January. A change Alberta's Open for Summer Premier is not rushing towards.
We think the program's working well. It will be in place at least until the first quarter of next year. We'll assess it then based on COVID trends here and around the world.
When it comes to this pandemic, no two jurisdictions have handled things the same way. But after a disastrous autumn across much of the West, Canada's winter months will undoubtedly demand some caution.
As vaccinations keep ticking off in Canada, some provinces are already further lifting more pandemic restrictions. But will Canadians be able to stop worrying about wearing a mask just as quickly?
Heart transplant recipient Mike Willis can't just rely on his vaccinations to safeguard him from COVID.
I'm good with people wearing a mask. Someone wearing a mask protects me more than it does them. It helps prevent the spread of droplets, which is basically one of the biggest spreads for COVID.
Mask mandates have been the standard pretty much countrywide, but those protections are slowly being lifted, with plans to remove them in Saskatchewan next month and early next year in Ontario and possibly Quebec.
We also know that when we lose mask mandates, voluntary mask use goes down.
Dr. Catherine Clace, who runs a website on effective masking, says when that happens, COVID, especially the Delta variant, can surge.
And we saw that in the UK, and we see the problem that they're having with transmission in the UK right now.
And we've seen it here at home. In Alberta, no masks and low vaccination rates caused a near collapse of its ICUs. Doctors there don't want to see history repeat itself.
The question that we don't know is how high of a vaccination rate is good enough to be a measure as a standalone measure. And I think we really need to have caution going forward that this is really a combination deal.
A combination of vaccinating the next eligible population, kids 5 to 11, increasing hospital capacity, tracking COVID cases closely, and keeping our masks on.
Masking should be probably the last thing that we remove.
Anything sooner, medical experts worry, is a political move without Canadians' health in mind.
British Columbia is set to become the first province to offer a third COVID-19 vaccine dose to the general population.
Within BC's ambulance service, there is a small percentage of paramedics willing to avoid the COVID-19 shot and not get paid.
We'll uphold their rights and represent them as best we can through our duties, but we also have a duty to abide by the laws that are in place.
4,000 healthcare workers are now off the job in the province on unpaid leave, but the health minister isn't backing down from making vaccinations mandatory for frontline workers.
The requirement to get vaccinated is an absolute necessity.
While those healthcare workers haven't received their double dose, the rest of British Columbia is getting ready for a possible third. So as long it's 6 months after their second dose, it's a first in Canada.
And if you look at the BC testing rate,
infectious disease experts are watching the case numbers to see if resistance is waning, but say boosters are inevitable.
We're probably going to need another booster on a yearly basis beginning next fall or thereabouts. So this is part of us getting into the new COVID normal.
A normal that would get us out of the pandemic and into the endemic phase.
We really need to all do everything we can, whether it's in our profession or personally, to make sure we get through this. We're so close.
There's still some convincing to do, even among the ones supposed to be helping the sick.
Keep watching Voice of Canada for further updates. Visit our website voiceofcanada.tv.